And may I now call upon Dr. Ajanta Keshavaraj to introduce our chief guest.
We are deeply honored to welcome Professor Jairaj Pandian, our chief guest today. Professor Pandian is the president of World Stroke Organization, the first Asian to hold this position, and currently serves as a professor and head of the Department of Neurology and the principal at Christian Medical College, Ludhiana. He is an internationally recognized stroke expert with over 280 publications and has played a pivotal role in shaping stroke care globally through his work with the World Stroke Organization, the Indian Council of Medical Research, and the Indian Stroke Clinical Trial Network. Under his leadership, Christian Medical College Ludhiana became the only World Health Organization collaborating center for the stroke in the world. We are privileged to have him with us today. It's over to you, Professor.
Hi, Bhavan. Vanakkam. Respected guest of honor, Professor Vasanthi Arasaratnam, Vice Chancellor at Northern University. Special guest, Professor Resham Regal, Senior Lecturer in Computer Engineering, University of Peradeniya. President of the Association of Sri Lankan Neurologists, Dr. Ajanta Keshavaraj, and President of the National Stroke Association of Sri Lanka, Dr. Gamini Patirana. My esteemed colleagues and friends, Dr. Padma Gunaratnam, Dr. Udaya Ranavaka, and distinguished international guests, Professor Henderson, President-elect of the World Stroke Organization, Dr. Deirdre De Silva, Secretary, World Stroke Organization, and members of the Board of Directors of WSO, Dr. Shailaja, Dr. Padma, Dr. Ivy. It is both an honor and privilege to deliver the inaugural address at the Jaffna Stroke Symposium and ASN regional meeting. As a principal of Christian Medical College Ludhiana since 2018, whenever the first year MBBS student enters the medical school, I ask few questions. So one of the important questions is, why did you select this MBBS course? Or why do you want to become a doctor? There are some stereotyped answers. The common answer is, I am fulfilling my parents' dream. And second answer is, I don't know, but I just apply. But there are few students who, there are some life events which change their objective towards a career. For example, some students would say, when I was small, one of my relatives got admitted in a hospital, and I went and saw the doctors, how dedicated they are, the nurses, how caring they are. That really impressed me to take a career in medicine. Similarly, for me, in my early career as a neurologist, Dr. Shailaja and me, we did neurology training at Sri Chitratanal Institute, Trivandrum, and she was 1 year senior to me. Our common mentor was Dr. K. Radhakrishnan. Professor Radhakrishnan is a well-known international epileptologist. So my first 3 years in CMC Ludhiana was in the area of epilepsy. Like Dr. Shailaja also focused on epilepsy. But in 2002, when I was sitting in the OPD, and I saw a young lady around 45 years, her daughter was a caregiver. She had a tachy, total anterior circulation infarct, completely paralyzed, left side weakness, disabled, modified ranking score of 5. And I asked the daughter what she was doing. And she said that she was doing her college education, and she had to discontinue the college education because she became the carer for a mother. So this is a common scenario that we all encounter in our outpatient clinics or in the in-hospital ward. And this incident really helped me to refocus from epilepsy to stroke. And we all know stroke remains one of the leading causes of death and disability worldwide. Alarmingly, over 2/3 of all strokes occur in low and middle income countries. In South and Southeast Asia, we face unique challenges from diverse stroke etiologies to disparities in access to care. Stroke often strikes at a younger age in our region, leading to devastating consequences for families and significant economic burdens on society. The World Stroke Organization envisions a world where people live free from the effects of stroke. Its mission is to reduce the global burden of stroke through prevention, treatment, and long-term care. This includes enhancing stroke prevention and treatment, strengthening rehabilitation and support systems, raising public awareness, and advocating for policy change and investment in stroke care. How WHO could work with ASN and Stroke Association of Sri Lanka in promoting stroke care in Sri Lanka. Number one, World Stroke Organization has launched a revised version of Stroke Center Certification Program. Certification by an external agency is very crucial to see how well we are performing. So there are about I think close to 50 quality indicators in this process that we measure, and that really affects the patient outcome. Example, door to needle time. If it is shorter, then patients will improve. And if you implement all the stroke unit care, like control of blood sugar, fever, swallowing assessment, that itself improves outcome. So these important KPIs are being monitored through the certification, and we have two categories of centers, that is essential stroke center, where there is a facility for intravenous thrombolysis, and in advanced stroke center we have EVT facility, neurosurgical facility, etc., and also neurointervention procedures for stroke. And from WHO point of view, we would like to see at least 10 stroke centers certified in the next 2 years. We always try to work with regional organizations and also with the Ministry of Health of the government. And we'll be keen to work with your ministry and also with both the organization to implement this important program. The second way that we could work together is a membership. WHO has individual membership and also stroke support organizations. And we need more members from Sri Lanka. That will help. At least so far we have not had any board member in WHO after Dr. Padma Gunaratna completed her term. So there's a long gap, and we need representation from Sri Lanka. Thirdly, Future Leaders Program. Now, we want to identify young stroke physicians across the world. And this is a flagship program of World Stroke Organization. I would like to see a few youngsters being selected in the next cohort. That the selection process will begin next year, probably in the month of March. So this capacity building initiative marks a significant step forward in strengthening stroke care in northern and eastern part of Sri Lanka. It is a testament to what we can achieve through collaboration, dedication, and shared vision. On a personal note, I want to share links with Sri Lanka. My wife Pamela, her grandfather was a principal at Carey College, Colombo, and her mother completed her schooling in Holy Family Convent School in Colombo. And we visited this school a few days ago and also saw the house they lived. And it was a nostalgic experience for both of us. For me personally, in the early 1980s, I did my early schooling from Chennai, and during 10th standard, my father was transferred from Chennai to Tirunelveli. And those were the early days of television in India. So only in Chennai the television program was available. So we had a TV set, and in Tirunelveli there is no telecast. After 6 months, Rupavahini was introduced in Colombo in Sri Lanka. And some of the southern districts of Tamil Nadu, we had the fortune of capturing that signal. So there was a flurry of TV business in southern districts of Tamil Nadu. And I used to watch some of the Rupavahini programs, like the classic ones is Mind Your Language. I don't know how many of you know. And FA Cup, I was so passionate about watching FA Cup, and also many Sinhalese and Tamil movies. I was so familiar with the Sri Lankan national anthem today when it was played. I was just remembering those days of Rupavahini and its impact in southern districts of Tamil Nadu. And I will conclude with this famous Thirukkural, and it is very appropriate for me to cite this Thirukkural because we are sitting in the Thirukkural Cultural Center. We know Thiruvalluvar was one of the famous Tamil poet. There is a disagreement whether he lived in 1st BC or a 6th century BC. And this is a choral about 391, which is about education. I'll read in Tamil and then translate. Karka kasidara karpavai katrapin nirka adarku taga. The translation goes like this. Learn faultlessly what is to be learnt, then practice what you have learnt accordingly. So what we learn from this conference, we have the moral responsibility to practice wherever we are placed. I am confident that this program will improve the outcomes of stroke patients in the region and also in Sri Lanka. Thank you all for being part of this important journey. Thank you very much.